I can 100% bet you that you, someone in your family, someone you know, some loved ones, some not so loved one also. Sometimes you have to go out for dinner or out to restaurants with them, or sometimes you have to cook with them. Someone will have a food allergy. I can bet. It's so common. 1 in 10 adults, 1 in 13, 14 children have a food allergy, and it's becoming more and more common nowadays. So it's something that you definitely have seen around you. So today's video we're going to talk about food allergy and signs and symptoms, what is it to, how to avoid, how to prevent, and how to treat. Okay, so food allergy, again, like how we talked about allergy in our first video, allergy is our immunity, our immune system is acting abnormally to something, to a foreign substance that is not harmful. So our immune system has to find out what is foreign from self. So whatever it finds as foreign, it will treat, like it, some things it will develop some immunity to, so that it won't react. So most of our foods are that, but sometimes there are some proteins in some food that our immune system doesn't recognize that this is normal, and it mounts an excessive response. So the kind of immune response to food is IgE mediated. So there are many types of antibodies, and if it is IgE antibody mediated, then we call it food allergy. It might be a bit too technical, it's okay if you don't understand, but if just someone has a food allergy and they want to understand more, so it's an IgE antibody mediated response to some food. Okay, so what are common foods that it, like, you can be allergic to? So, most commonly, people are allergic to peanuts, shellfish. So, fish also, shellfish is different and normal fish is different. Shellfish is like your crustaceans, shrimp, lobster, crab, octopus, these are all considered shellfish. And then your normal fish like tuna, salmon, cod, tilapia, these are all fish. So fish and shellfish. Sometimes you can tolerate fish but not shellfish. Then what else? Some people can have allergies to eggs, milk, sometimes even wheat, rice. So people think that wheat and rice are carbs, so how can, like, allergies to protein? But everything has small amount of, like, some amount of protein, not small. Wheat and rice don't have small, but yeah, some amount of protein. So you have the allergy to the protein component of the wheat or the rice. Soy, nuts like tree nuts, pistachio, cashew, almonds. So these are other things that you can have food allergy to. Okay. What are the signs and symptoms? So again, I told you it's an IgE mediated reaction. It happens very quickly. So within 15 to 20 minutes, half an hour or an hour of eating something, let's say for this video's sake, we'll say that I am peanut allergic. Okay, so within 15 minutes of eating peanut, if I start having hives all over my body, hives are again those small red bumps that come and itch a lot and then they disappear without scarring. So that's hives. So if I start having hives, if I start having tongue swelling, lip swelling, throat swelling, sometimes I can even start having difficulty breathing, like, feeling of chest tightness, wheezing. Sometimes can also be like immediately vomiting, like within 15 minutes to half an hour of after eating that food, immediately wanting to vomit or having a diarrhea. And in worst case, you can even have a syncopal episode that you can just collapse or pass out. These are all signs and symptoms of food allergy. So two things that are important is it will present in these systems, so your skin, your respiratory, your GI, or your circulatory, and it will be immediately after having the food. So how to differentiate? Like, some people say that I am allergic to some food, but next day I don't feel so good, I feel bloated. Those are not signs and symptoms of food allergy. You may be intolerant for whatever reason, but that's not what food allergy is. Okay. The next thing about food allergy is how to differentiate it from some other things that seem like food allergy. So some people have milk and they have diarrhea. So that is lactose intolerance. Lactose intolerance is not milk allergy. Lactose intolerance is because there is a sugar in milk that our bodies, as we age, we can't digest. So if you have lactate milk, you can have the lactate milk, but like lactose free milk. But you have the diarrhea after milk. So that is not milk allergy, that is lactose intolerance, that is different. Another thing that some people have is oral allergy syndrome. So when like say supposing someone has oral allergy syndrome, they have pineapple or kiwi or banana, and then they start having tingling and this sensation around their mouth, that there's something funny, something itching, tingling, and that is usually like also immediately after having that food. And that also feels like food allergy, but it's actually not food allergy. It's called oral allergy syndrome. It's because some components in some fruits cross react with tree pollens. So, like how we covered in allergic rhinitis, you can be allergic to pollens. So, some things, the fruit has some things that cross react with pollen, and so you're having those symptoms. So, it's not really an IgE mediated response to food. So, it's not food allergy. Another thing that you can confuse with food allergy is called FPIES, or food protein induced enterocolitis syndrome. Basically, what is that? There's some protein in the food that is causing mostly GI upset. So, enterocolitis is you have diarrhea, watery diarrhea, sometimes bloody diarrhea. So it's mostly, and vomiting. So if it's always to that particular food, you only have GI symptoms, very bad GI symptoms, then you have to also think about FPIES. Okay, so how to differentiate food allergy from other things, from other like food intolerances? Okay, and what are the common food allergens we talked about? Okay, so how to prevent, how to deal with food allergies, how to manage, how to treat? Okay, so how to prevent early introduction? So this is my message to all mothers: introduce foods, especially allergenic foods, early. Within, like, as soon as the baby is 6 months old, after that start introducing little by little. So peanuts you can introduce in the form of peanut butter or nut butters, because nuts are very difficult to have for children because they can choke. So what else? Give them wheat, give them rice, give them cow's milk. Oh, after 1 year, so cow's milk after 1 year. Give them eggs. So if you introduce food early, then there are lesser chances of having the allergy. Before we used to be scared and not introduce food early, but if you introduce, it's actually proven that it decreases the risk of food allergy. Okay. If you introduce and you found that your child or you are having a reaction, then the best thing is to accept that food allergy, because if you accept it, you will know how to manage it and how to deal with it. It's nothing wrong to have a food allergy. It's like any other disease. And I think the purpose of my video is not only to educate you about food allergy, but also to build some sensitivity among like my viewers about food allergy, because sometimes it's very hard, like, especially people who have food allergy, they feel like, it's not my fault, it's something that my body is reacting to. And a lot of time, people don't take it sensitively, especially, in school, like school children. Oh, he's allergic to this and this. It's okay. It's important to accept the food allergy in yourself and also in your family member. Anyways, my grandmother always said, never trust someone who eats everything. So it's okay. It's okay to have some food allergies. Okay. So, what to do if you have a food allergy? Firstly, read the label very carefully. You have to make sure that you read everything that you eat. Even if you don't expect something in some places, read every label, because that will build a habit of reading labels. So, if supposing you're shrimp allergic, you don't read the label. No, you should read, because then when you are exposed to something that might have it, then you would have read it. Okay. The other thing, if there is no label information, then ask whoever has made it. If this has any nuts, if this has any peanuts, if this has any milk, if this has any egg. Okay. What else can you do? So EpiPen, epinephrine auto-injector is available and prescribed to people who have severe food allergies, especially if they have anaphylaxis to foods. So how to use that, I will cover it in a separate video. So please watch that video. It's very important to carry the EpiPen with you, know how to use it, always have it with you, and use it fast and use it early. So when you start feeling like you're going to have symptoms of food allergy, start using the EpiPen. Okay. What else? Is there something else that I wanted to cover? Uh, I think I think that's it. So if you have food allergies, it's a good idea to visit an allergist. They can do like skin tests for you or blood tests and find out exactly what you're allergic to. Sometimes you feel like you're allergic to something, but it's something else. A lot of our food is so processed that we are allergic to some preservatives and not the food itself. So if you have the food itself, it won't cause anything, but maybe something in the box, some preservative is what you're allergic to. So it's always a good idea to go to an allergist, get the testing for the food allergy. And then, because especially in children, if they start avoiding eggs and milk, they're very high nutritional foods, and you don't want to avoid them if you're not allergic. Okay. So please leave any comments below. I thank you if you've watched the whole video. And please leave any questions and whatever you want me to do the next video on. All right. Bye.